Good morning, everyone. My name is Frank, and I want to welcome all of you to today's presentation. Now, the purpose of today's presentation is for us to have a fair view of an analysis that has been made to help this company with its influenza season planning in the United States. So I will just go ahead and provide my findings towards this business objective. So the objective of this analysis is to help the company with the upcoming influenza season, which is a season that causes a lot of people to die across the United States. And as a staffing agency, it's become imperative that you be able to know the right amount of staff that you'll be sending across the various states and how you're going to make this decision. So with this analysis, we'll be considering 3 business questions, and we'll look at them from here. The first one will be, we'll look at which state has the most vulnerable people. And we'll also look at how the influenza mortality rate among the US population has been over the years. And finally, we will consider how the state population is distributed and how it's going to affect planning of the upcoming influenza season. So with this analysis, I received population data, I received census data, I received a survey data which shows hospital visitations by people who have recorded influenza-like illness, and also I received data that shows the number of hospital providers provided across the United States. So this first visualization, we are looking at the number of people who have reported influenza-like illness or who have visited the hospitals. That's hospital visitation data. And we look at as well the number of hospital providers that are provided across the United States. So from this visualization, we can see that states such as Illinois, Texas, California are recording high influenza-like patients, as in people that visited the hospital. And this is giving us an overview of what is to come in further analysis. So from our business objective, we realized that at a stakeholder meeting, it was mentioned that in the past, people who are regarded as seniors or above 65 years have oftentimes been vulnerable in contracting the influenza. So as an analyst, I set out to underpin the truthfulness of this situation, whereby I performed certain analysis in a form of correlation analysis, and in doing this, it came out 95% of confidence level with regards to the number of deaths that are being had among people that are above 65 years old. Now, in a further analysis of this frequency chart, we can clearly see that from the label here, we can see that the highest number of people who are dying are between the ages of 65 and 85 years old. And in fact, those in the 85 years old are receiving a higher death rate, which undeniably could be attributed to underlying health factors because these people are old. And this hypothesis, which was an alternative hypothesis, was as well proved through further statistical analysis, as before mentioned, in the likes of correlation analysis and therefore. So we then go further to analyze the mortality rate across 65-year-olds, because now we've identified that the death rate among people who are above 65-year-old are high, and these are the most vulnerable people in this upcoming influenza season. So we want to look at the distribution of this age group when they are dead across the various United States, so that we can further know the states that will be ranked on a priority scale to receive more health workers. So looking at this graph, we can clearly see that the deaths are higher in states like California, in states like New York, in states like Texas. And 3 of the states that are recording a higher death of people in the category of more than 65-year-olds are also states that have most death occurring. So that is to say about 25% of the states that have population greater than 65-year-olds are also states that are recording higher death rates. And we shouldn't forget that in the previous chart, we also saw the relationship between the hospitalizations, and which also features states like Illinois, which is here, states like Texas, states like California, and these states are as well showing a higher sum of death rate. So from this analysis, we can further conclude that in this line chart, whereby we try to analyze the trend of influenza death over the years. Now, looking at this trend data, we can see that there hasn't been a relatively much difference in the number of deaths over the years for influenza patients over the ages of 65 years. So this now helps us to realize that in the upcoming years, there wouldn't be any significant changes. There wouldn't be any significant changes of death among these age groups. So now, one of the metrics that we would want to continue to measure over the years will be the age distribution, because now we can clearly conclude that states that are recording higher death rate of seniors or people above 65 years old must be given attention to the staffing distribution. So these states must receive higher staff numbers who will be able to contribute to the effective control of this upcoming flu. Now, one situation that is quite worrying is Alaska. Alaska here, which is showing quite a higher number of death rates of more than 65-year-olds, but yet Alaska in the previous slides is not showing a considerably enough number of recording of hospital providers in relation to other states which have in higher numbers of 24,000. So going forward, we would want to say that further analysis could be made on the hospital providers across states like Alaska, so we'll be able to know whether the providers are enough for the upcoming influenza season for the number of patients that they could record, because we shouldn't forget that Alaska as well has quite a higher population number. So we would want to give that as a recommendation that going forward we would have to analyze more hospital providers data. So this concludes the analysis that was made, and in summary, we have concluded that bigger states that are recording a higher number of death rates among age groups older than 65 should be receiving higher medical staff ahead of the upcoming influenza season. Thank you so much. And as part of the presentation, I have provided a summary of the data limitations that was found, and any other findings that you'll be interested in regarding my statistical analysis. I'll be willing to provide them in an email. Thank you so much for your time, and thank you for listening.